Dorothea Orem's Self-Care Nursing Theory by Vanessa Bennett. Dorothea Orem, who is the mother of the theory of self-care, was born in 1914 in Baltimore, Maryland. She passed away in Savannah, Georgia in 2007. Orem had an extensive education, first graduating from Catholic University in Washington, D.C. with her BSN in 1939. She then continued her education to the Catholic University of America, where she obtained her MSN. Because of Orem's theory work and contributions to the nursing practice, Orem was given 2 honorary PhDs. Her first publication was Nursing Concepts of Practice in 1971, which is still used today and still very relevant. It appears that Orem was completely immersed in her theory work because I was unable to find any information related to marriage or children. The concept of self-care are activities that are performed on his or her own behalf to maintain life, health, and well-being. Orem's theory of self-care is considered a grand nursing theory because it covers a broad scope of general concepts applicable to all occasions of nursing. Orem believed that people have an innate ability for self-care, and nursing should focus on influencing that capability. Orem felt that nursing in hospitals needed to improve and be of higher quality, which is when she began exploring the self-care theory. The theory of self-care is used in all areas of healthcare, but is especially important in settings where patient independence is vitally important, such as rehab and primary care. Orem views a person as physical, social, and psychological, with inconsistent degrees of self-care abilities. The nurse helps identify and determine and achieve self-care goals. Orem believed the environment affects the person's ability to care for themselves. By reflecting in their environment, the nurse can guide the patient into seeing barriers in his or her environment and see how to make changes that are beneficial to their health. Orem's theory views the health meta-paradigm as physical, mental, and social well-being. It is the crucial goal of Orem's theory to keep the integrity of human structure. The nurse discusses the limitation concerned in meeting the requirements for self-care and its effect on self-care. In Orem's theory, the nurse meta-paradigm is for the nurse to support and encourage patients to perform self-tasks. The nurse can also help the patient to determine which goals he or she would like to focus on and how to achieve them. There are 2 concepts of self-care: to stay alive and to act deliberately. To stay alive and remain functional humans who engage in consistent communication and connect among themselves and their environment. The power to act deliberately is exercised to identify needs and make needed judgments. Assumptions of Orem's theory is that people should be self-reliant and responsible for their own care, as well as others in their family who need care. Each person is a distinct individual who has his or her own independent self-care needs. The nurse takes action to educate and encourage the patient on his or her self-care goals and needs. The proposition of Orem's theory is that self-care is performed by mature and maturing individuals. Self-care is learned and performed deliberately in response to a need. The action performed are to maintain, restore, and improve health. Limitations and self-care deficits related to limitations or barriers that prevent individuals from meeting their requirements of health, well-being, growth, and development for both as an individual and the environment around them. Orem's theory of self-care is taught in a director of nursing practice programs, but is also widely utilized by RNs with either an ASN or a BSN degree. Nurses receive education on self-care for themselves as well as their patients. Nurses learn the vital need of a patient and how they can assist their patients in helping themselves. It helps nurses understand what health-related self-care issues each patient faces and enables nurses to develop appropriate interventions that meet the patient's needs. Orem's theory of self-care has shaped nursing practice and is still very prevalent today. It directs the nurse to assess each patient's ability to care for him or herself. It is very prevalent in rehab nursing, where it suggests that patients are better able to recover when they maintain a level of control and independence. Orem's theory in self-care is very important to research. It guides research in implementing self-care for different disease processes to reach ideal health. It is also very prevalent in preventative research on what self-care can be done to prevent different diseases. I currently work in a skilled rehab facility where we have all types of patients, from surgery recovery, wounds that require inpatient care, rehab after falls, or rehab after brain injuries. Self-care is vital in my field, where our goal is to get the patient back to their previous level of functioning or to help them adapt to a new level of functioning. Self-care assists us in creating goals for physical and occupational therapy. The more we can encourage a patient to do things for themselves, the more control they feel that they have over their situation, the more drive they have to meet their goals. By determining what self-care goals the patient determines as essential, it helps us develop a plan of care that the patient is interested in and therefore very invested in. When a patient is active in his or her recovery, they are able to meet goals quicker and go home faster. Orem's self-care theory gives new nurses a foundation to build on. It gives them a place to start with their patient if they are unsure what to do. It directs them on what patient education their patient needs and what to prioritize per the patient's goals. Self-care helps nurses encourage participation from the patient and helps them to reach their goals that are important to them. And here is a list of references where I found all this very wonderful information.